If you're a woman in midlife, exhausted, running on fumes, and wondering if your sleep could be affecting your health long term, the answer is yes. But before you panic, there is so much you can do to protect your health, even starting tonight. Hi, I'm Dr. Val, an integrative sleep physician and women's sleep expert. Today, we're talking about the link between sleep and cancer, especially in women going through perimenopause and beyond. We'll cover what the research says about night shift work, melatonin, and your cancer risk, plus how you can take action today to protect your long-term health. So what do we know? The World Health Organization classifies night shift work as a probable carcinogen due to circadian rhythm dysfunction. So what do those words mean? Well, your body is running on this 24-hour clock known as your circadian rhythm. And when that rhythm is off from chronic sleep loss or working at night, it often can throw off your hormone regulation, your DNA repair, your immune function, and even cell growth. So melatonin is really important to understand, and it's not just a sleep hormone. It can actually be a very powerful antioxidant that helps with things like inhibiting tumor growth, regulating estrogen, reducing oxidative stress, which is basically inflammation, supporting the immune system in detecting abnormal cells. Women who worked rotating night shifts for greater than 10 years may have a 20 to 30% increased risk of breast cancer. Lower melatonin levels are associated with breast, ovarian, even prostate, and endometrial cancers. And here's the empowering part. Even if your past sleep habits weren't the ideal, your biology is adaptable. There are steps you can take today to shift your risk in the right direction. So sleep is just one piece of your prevention toolkit. You should also stay up to date with your age-related cancer screenings. The first is the mammogram, which can detect breast cancer. Recommended age to start is 40 or even lower if you're higher risk. For colorectal cancer, a colonoscopy is recommended at 45, but same thing, if you're higher risk, have one done sooner. Cervical cancer, this is why we do routine pap smears and HPV testing. For lung cancer, if you're higher risk or have a history of smoking, a low-dose CT scan could be helpful. For skin cancer, have an annual skin check, especially if you're fair-skinned or have high exposure to UV light. There are also genetic testing if you have a family history of things like breast, ovarian, or colon cancer. Talk to your doctor about the BRCA1, BRCA2, or Lynch syndrome. And if you test positive, you can start earlier screening and maximize lifestyle changes and explore some risk-reducing cancer strategies. So what are things that you can do about your sleep? Number one, support your circadian rhythm. Get natural light in the morning within the first hour upon awakening. Make sure that you dim your lights at night. Avoid screens before bed or use blue light blocking glasses. Sleep in total darkness. Even some dim light at night may suppress melatonin. And make sure you monitor your lifestyle factors. Alcohol is a big one. It can impact your sleep quality. It can reduce REM and blunts melatonin, and it has been associated with cancer risk. Late night snacks high in sugar or refined carbs can also lead to some sleep fragmentation. You can get melatonin from melatonin promoting foods like tart cherries, walnuts, goji berries, pistachio. You may want to consider trying a melatonin supplement, but talk to your healthcare provider about that. Lower nighttime stress can be really helpful if your mind is just going and that's keeping you from falling asleep. Try practicing breath work, gentle yoga, or journaling. There are really great calming apps or sleep meditations, as chronic stress can raise cortisol and block melatonin. So work on reducing stress in and around sleep. Also, one of my favorite things to talk about is ruling out obstructive sleep apnea. If you're snoring, gasping, or feeling unrefreshed in the morning time, ask for a sleep study, as untreated sleep apnea can increase inflammation and might compound your risk for cancer. You may feel that poor sleep is just part of midlife, but guess what? It is not your fate. Your body is not broken, it's in a transition period, and with the right support, it can restore its natural rhythms. I'm Dr. Val, and I'm here to help you sleep better and feel like yourself again. If you found this video helpful, consider joining the Sleephoria Sisterhood. It's an online community where we talk about all things women's sleep. Until next time, bye-bye.